everyone, my name is Dr. Cassidy and this is Dr. Jess. She's going to be helping me out today as we go over tools and tips for your upper back pain. Here at CHIRO for Moms, we see and treat a ton of upper back pain throughout pregnancy, but especially postpartum. Mamas are nursing, they're holding babe all the time. We love to look down at our lovely little one, regardless of just nursing or holding. So these tips are for you if you're feeling an ache, a pinch, a tight spot between those shoulder blades or those lower neck muscles. So to start, we're just gonna go through some at-home tips. And the first one is a very basic stretch. Later on, you're gonna see me working on Dr. Jess's upper trap, but this is going to stretch it out. My favorite way is to loop my hand behind my back. Do you like to sit on your hand? Is that the version you like to do?
I think that's Dr. Mariah. But
that's
yeah,
Dr. Mariah. So
here.
Yes, my arms are too long for that version, so I just loop it around my rib cage here, and I go directly over, bending that ear to the opposite shoulder. Not forcefully holding my head, just over pressuring slightly.
It feels amazing.
It feels so good. So good. And then always do both sides, even if you're feeling pain just on the one. And this is targeting a little bit more of that lower neck and neck pain in general, but your upper back pain definitely plays into that.
A huge role, especially for when we are working at our desk and especially throughout that pregnancy, because fun fact, ribs expand up about 50% as you go through your pregnancy journey.
Yes.
And so you can find that, yes, we do get rib pain. We have a video on that one as well. But that upper back can be a stickler as well with when you're
pregnant.
Growing babe.
Yeah. Yes, and then your boobs are bigger, so you don't know what to do with all of this volume. We have those hunched shoulders, holding a babe, nursing, doing one of these to get pumping or latched. There's a slew of issues, not to mention that relaxin piece. So relaxin's that hormone that makes you all wiggly during pregnancy, peaks at the end of the first trimester, but it's elevated upwards of a year post breastfeeding. So not just a year postpartum. When you finish breastfeeding, you'll have elevated levels for that following 12 months. That is a very, very, very long time, you guys.
Exactly. It's a super long time.
So important to be aware that you might have some weird sticky spots or maybe a random ache this week, different ache next week. You are in a very common place with a world of other mamas. So don't you fret. Our second exercise that we are going to walk through today, I termed wide elbows, for the lack of a better phrase. Naturally, you're just going to make your elbows go wide with your hands behind your head, and then you're going to stretch your elbows and try to get them to touch. So you might be here, that's totally cool. You might be almost touching, totally cool, or maybe you're touching to start. Then you're going to take your elbows nice and wide. And would you mind spinning around for us, actually? Thank you. So when her elbows are nice and wide, Dr. Jess is squeezing between her shoulder blades. She's almost tucking these shoulder blades into her back pocket. So that's a great way, again, stretching, and then to squeeze, just tuck those shoulder blades into your back pocket. You're activating that mid-back that's been stretched and hunched for, maybe a few months now.
It feels incredible.
Yes, and it kind of fires things up. People are a little bit surprised. There is a little bit of a burn to it. The other solution is our lovely Pilates ball trick. So we like to deflate a typical Pilates ball a little bit, so there's some squish, and then you place that ball in between your shoulder blades, and you lay on back with your arms into a goalpost position. Find where you're feeling sticky. You could move it even a touch lower, and then arch over.
This is a beautiful positioning to stretch out that chest muscle because our chest gets super tight when we're always rounded. You can have a little bit of weight with yourself too if you want to hold cans of soup just to open up you a teeny bit more if you'd like that extra pressure, but it's not necessary because you get a good stretch no matter what.
Yes, that is a really good tip. So add a little bit more resistance with some weights or some soup cans. And then the final one is eagle arms. So this one's very easy to get into. You essentially loop one arm under the other and then have your arms meet. Today I'm already feeling a stretch, but you can look down towards the bottom shoulder and that stretch will intensify even more. I like to keep my elbows parallel. You can try raising them up and down and kind of feel where you are tightest. And then, of course, we do both sides, always, always, always. And again, we can look down at that bottom elbow if we need a little bit more intensity with this stretch. Hot tip for the chiropractors watching out there, your patients will adjust better if you make them activate the muscles around your spine. So you can implement some of those activating exercises before your adjustment, which we're gonna get into next. So in the office, I'm gonna actually have Jess lay face up to start. We're gonna work into her pec muscles, the pectoralis major and minor. Those are the chest muscles. Those are what the bros are chest pumping at the gym, okay?
Yes.
And that's what we're gonna get into, not only because of that breast tissue growth, but kind of like Jess was mentioning earlier, that hunched position that our mamas are currently in, upwards of, like 16 hours a day or something ridiculous. So we can passively go through this motion, simply shortening that pec muscle, pinning that pec muscle, and then lengthening it. I can also, is that a little bit tight? And now I'm gonna have Jess actively do that. So actively pinning and stretching this muscle will just intensify. She even made a little face for me. That was lovely. Come back, just do one more for him.
So tight.
So tight, so great. A lot of our postpartum mamas, along with their upper back pain, it can then lead to shoulder pain, elbow pain, maybe even wrist and thumb, might start having tingly, numb fingers. And this is the first place we check because it's most likely the spot where your nerves are getting pinched if it's not in your neck. Good, and I just feel like making Dr. Jess work, so then she's gonna do 2 active ones on this side to make her even. That's beautiful.
My right arm is so much tighter.
Sure is, girlfriend, yeah, Ooh, the toes even curled.
Yeah.
That was perfect. Sit on up for me. We're gonna show them an anterior adjustment next. So we use this lovely board underneath her back. Just takes out some of the squish of the table. Very good. Beautiful. I would like you this way. All of the arms have to be different. Just finding that spine. I'm gonna put my fist kind of under it. Breath in for me, Dr. Jess, and all the way out. That was beautiful. I think you guys might have only heard the squeakiness, but Dr. Jess got a beautiful release there. So that is one way we like to adjust. Other way would be face down. So Jess is gonna go face down so I can kind of show you what that looks like. Beautiful. So for upper back pain, there's 2 components that we like to focus on: the spine, yes, but also those ribs. You have a lot of rib movement. Those things can start popping out, especially breastfeeding. So we also like to check your ribs, which yes, we can adjust your ribs. And I'm actually gonna go over to this side. Breath in, Dr. Jess, and out. Good, nice little push. So obviously when we're doing a rib, it's not gonna be directly on the spine, but when we do the spine, it will be. So breath in and out. And that was a baby one, just a little guy. Fabulous. And now I'm gonna get into the posterior shoulder as Dr. Jess is face down. So we did the front of the shoulder, that chest that's rounding us forward so much. Now we're gonna work on this posterior shoulder because a lot of times it's carrying a lot of weight that you don't even really realize. So kind of near that armpit, we're targeting that teres minor, and pushing through that. It's part of your rotator cuff, super important. Jess can actively pin and stretch that. Oh, beautiful. Ooh, that's awesome. It's so tight. She's like, I don't know what to do over here.
Yeah.
Fabulous.
Need more muscle work.
Clearly, Dr. Jess needs more muscle work in her life. Sit on up for me now. We are just gonna show them some neck soft tissue because I did promise we would do that. Yeah. Do you want a hair tie, dear?
I'll just hold it.
Okay, that works. No, I always have extra. and we're just gonna do this one side. So we use Deep Blue here in the office. We love it. BioFreeze works great, or just lotion. Takes out some of those friction, or that friction piece when you're doing soft tissue work. So I'm gonna have Dr. Jess look to the left and then drop her head down. Bingo. Good, come back up. We're gonna turn and drop. This is stretching, lengthening that upper trapezius muscle. So playing into your back pain, playing into your neck pain, could be playing into your headaches. Beautiful. The other one we like to do is chin to chest, and that even works the lower paraspinals of your neck and upper back. You can actively stretch and massage yourself, especially in the neck region. Similar thing, if whatever muscle that we want to stretch, we pin it and move it around. Don't overthink it. Move that neck, pin, stretch, move what feels tight. Go get a massage. Implement some of our at-home tips. And if you're noticing things more so in the head and neck, the shoulder, the ribs, kind of like we mentioned before, go check out some of our other videos. They're gonna be really, really helpful. We actually have an entire video dedicated to alternative nursing positions. So they're biomechanically friendly positions that you can try out for nursing. Give it a try, leave us a comment of what you guys need next. Of course, subscribe to our YouTube channel so you can see all of the new videos we put out, and we'll catch you next week.